Hello, PsyQ community, and welcome to today's webinar, Social Determinants of Health and Peer Support in the COVID-19 Pandemic, Impacts in the COVID-19 Crisis. Thank you for joining us today. I'm Rick Kegler, Managed Market Liaison and member of the Medical Affairs team for Otsuka Pharmaceutical Development and Commercialization, Inc. I'll be serving as the moderator for today's exciting discussion featuring David Larsen and Dwayne Mayes. So I'll begin today with Dwayne and ask him, how do you see the stay-at-home directives impacting the affluent versus more vulnerable population, including the homeless?
Thank you, Rick. Good morning, David. Good morning, everyone. It's very interesting. It took less than 3 months for this COVID-19 pandemic to really expose some of the most fragile fault lines across the country. Most of them can be defined as pointing out the difference in access to health care and supports by race and poverty, two of the most larger social determinants of health that the nation faces. We've had to make very rapid adjustments in the way that we deliver services in a virtual environment, and it really highlights ways that we're going to be operating differently in the future.
Very nice. And David, your perspective?
I think what we've found is that our activities of the past are helping us with the current environment, and our steps into the future is to continue to address this. We've had quite a bit of experience lately in pilots around identifying social determinants of health in our populations, and developing ways to reach out to those individuals. We also invested heavily in telehealth, which has been instrumental in helping us maintain contact with many of our patients in our delivery system, and has helped us approach this pandemic head on. Certainly, we have identified a number of disparities, and we're trying to address those in different ways. And everybody has their challenges, and we're trying to be able to allow them to get access to health care and solve their social determinants of health issues proactively, so that they're minimize the impact of COVID in their lives.
So Dwayne, David mentioned telehealth. What do you see the impact of telehealth being on a go forward, both the good and the limitations?
Well, it's interesting. From an administrative perspective, we've had to make some very rapid adjustments in the way we deliver service to the most vulnerable individuals that we serve. Typically, we would have more face-to-face contact with individuals in order to address the social isolation, which is inherent with serious mental illness. And what we've discovered is that we've been able to engage individuals more frequently, and in many times, we've been able to engage with them on a more regular basis through use of either video or telehealth systems than we were before. So going forward, what we're planning to do is implement a hybrid model of engagement, which gives more consumer choice, if you will, to how individuals are more comfortable engaging. Some are more comfortable from the comfort of their homes. Others, if there are not any particular logistical needs which they have, they may be able to engage virtually a lot better. But it also presents some challenges. You know, we used to talk about the digital divide, which really highlighted limited access to both physical technology and the financial requirements of having, you know, unlimited data plans, if you will. And we've had to really figure out how we're going to use the resources that we have to make sure everyone can have access to this remote environment.
And David?
Well, we've experienced some of the same issues. We primarily, prior to COVID coming upon us, our primary focus was on using telehealth for urgent care. We've since expanded that significantly, but we always had the desire to expand telehealth into behavioral health because of access issues. And so this moving through COVID has helped us jumpstart those efforts, and we've expanded telehealth essentially across all aspects of medical care, including behavioral health. We've also worked with physicians to try to help them increase their capacity within their clinics, and we've changed our payment policies to reimburse for those services. We, however, continue to hear, especially seniors who are not comfortable in doing video on their phone, and they'd rather just talk. So we're trying to establish policies where we'll allow, you know, just voice conversations to be paid for, they don't have to be video enhanced calls or to allow for reimbursement, which is a big paradigm shift, but we're having to do that in order to meet the needs of our populations.
You mentioned the challenge with the older population. I recently read an article where they talked about patients that had autism and IDD and paranoia, communication issues, that those patients also, the physicians were having a difficult time dealing with those patients on a telehealth basis.
That makes sense. I could see that happening.
So Dwayne, we started talking about social determinants, and the CDC talked about with African Americans that they're more likely to die from COVID-19. They have multiple chronic conditions compared to the general population. How does this tie in with social determinants of health, COVID-19 hospitalization and mortality rates? What's your perspective?
Well, there's been quite a few articles already written about this. There are communities across the country with high chronic disease burdens, you know, such as diabetes, high blood pressure, asthma, obesity, and most of these diseases are tied to racial health disparities, and they're more vulnerable to serious complications related to COVID-19. Before we started, you know, today's call, you know, I was thinking about individuals who will live in high urban areas, very congested, high-rise apartment buildings, who may not have the opportunity to practice the social distancing, which is, you know, one of the recommendations that the CDC has put out, as opposed to individuals who live in more rural areas who may not have as close contact with others to help prevent the spread of the disease. So there are a lot of policies that, you know, need to be taken a look at right now to determine, you know, what's the best way going forward to prevent this sort of pandemic from repeating itself.
And David?
We've looked at the literature and been cognizant of those racial disparities. In our population, we have a higher percent of Hispanic individuals in our population, and we're seeing higher impact in Hispanic populations within our delivery system. We've tried to address that by aggressively translating all of our materials that we have for outreach to Spanish and widely distributing those. We also have a big mobile van. It looks like a big motorhome, and that van travels around to hotspots of COVID outbreaks, but it also travels out to the homeless shelters and parks outside the homeless shelters to do testing. And we've also positioned that van in areas geographically where the Hispanic population lives, and staffed it with individuals who can communicate directly with those populations in order to try to educate as well as make sure their testing is being done.
I do want to add something to that. Thank you, David. In addition to the physical health challenges, one of the other things we've had to acknowledge is the economic impact that this pandemic has had with increased housing insecurity, increased food insecurity. Many of the essential workers who may be hourly workers who are being challenged to go back into what can arguably be considered, high risk environments. And it's all playing a role in both exposure and being able to be more protected against infection.